Hello and welcome to my channel Empowering Aesthetic Excellence. In today's episode of the Aesthetic Dialogues, we are in conversation with Dr. Priya Parekh. She is a TEDx speaker. She is the founder, proprietor of Beauty Aesthetics Clinic in Pune, which is a skin, hair, and aesthetic clinic, and practicing since 2011. She is the founder and director of an NGO, Me to We Mission 2034. She is working for men empowerment and gender neutrality. She's also the member of Indian Association of Aesthetic Doctors. So without any delay, let's welcome Dr. Priya Parekh. Hi, Dr. Priya. How are you?
Hi, Dr. Bhavna. I'm fine. How are you?
I'm doing great. It's good to have you. Welcome to Aesthetic Dialogues. And
Thank you so much.
lovely to have you over here. Okay, so without delaying any further, let's just get to the questions. So, my first question to you is that, like when we all started, how did you embark on the journey into what was then the considered the uncharted territory in the field of modern medicine, the aesthetic medicine? And if you could share your story with all of us, that how did you get started?
So, honestly, Dr. Bhavna, my story is quite funny actually, in a way that I had just delivered a baby, and due to hyperprolactinemia, I had severe cystic acne. And this was around in 2010. And that is a time I remember visiting Dr. Jamna Pai,
Oh,
the legend of aesthetics.
yes, yes.
So that is where, I was introduced to peels and all those aesthetic treatments. And frankly, it was so interesting that I couldn't stop myself. And I started reading about it. Obviously, that time there were not many courses and all those kind of things.
We still
But
don't have.
I think, yes, yes, definitely. But then that, the desire to do it
Yeah.
was something which took me to aesthetics, frankly.
Yeah, that's great to know. And there is one common factor that I would like to mention over here about Dr. Jamnabai. I think she is the pioneer, and she's also
Yes.
channelized many individuals into aesthetics because I used to read her articles in Femina when I was in seventh and eighth, and I used to tear those and make a book out of them. So that was basically my first textbook of aesthetics, if I have to say in little terms.
True, true.
And I
Very
didn't
true,
know
very true.
what aesthetics was that time, but then I was like कि करना है तो यही करना है. I don't know what it is. you know
No,
so
definitely
it,
she's one, she's got that magnetic aura, and
yes,
you look at her itself, it's all aesthetics.
aesthetics, yeah, yeah. So I think she's channelized a lot of us.
Definitely.
Okay, so moving on further now, as you mentioned, there were no training, there is no formal training, there is no structured curriculum for aesthetics, and there are no clear guidelines also till date. And
Yes.
when we all began, there were still, there were hardly anything. So, what were some of the challenges that you faced initially, and how did you manage to cope up with them?
So I think my first and biggest challenge was convincing my family also that aesthetics exists.
Yeah.
There's something called as aesthetics, and I want to practice that. That was my very first challenge. The next obviously was there has not been any formal courses,
Yeah.
formal education for aesthetics. And third, most important, what I realized while I was practicing with one of the chain clinics is that experience matters a lot.
Yes.
So in aesthetics, if you don't have experience, the hands-on, the skills,
Mhm.
it's very difficult.
It's very difficult. So I guess the chain clinics play a very pivotal role in when it's concerned to experience and exposure, basically, not experience, exposure.
Yes. Yes.
Right, right, wonderful. So coming to addressing the elephant in the room. So there seems to be no definitive boundaries, and there appears to be a lot of uncertainty regarding who should address skin diseases versus who should address skin aging concerns, etc., versus beautification of skin. So, how do you perceive this lack of distinction impacting the individual choices regarding the beauty needs? and further how we can endeavor to bring clarity to this gray zone with a blend of professionalism and insights.
So, first and foremost, Dr. Bhavna, I strongly believe that there is a basic distinction between doctor and non-doctor.
Right, right.
This we all have to be very clear about.
Mhm.
Like, if you are not a doctor, then you are limited to the epidermis, and that also the first layer, the stratum corneum. You cannot go below that.
Beyond that. Yeah.
So that is something we all have to be very clear about.
Right,
Then comes the doctor's role, obviously. Now, as you rightly mentioned, that aesthetics has got no clear cut boundaries right now. I believe, on a personal note, that any doctor who has valid knowledge of anatomy physiology,
right.
who has skill sets of injecting,
Mm-hmm.
is definitely someone who should practice aesthetics.
Right.
And when I say aesthetics, it means aesthetics only.
Only, yes, because then only you can do justice to this. And moreover, above all, I think they should be passionate. Like you said, you wanted to do it, you wanted to pursue it. So that passion also has to be there.
Yeah, I mean, I still remember those early years where, I used to analyze every face which I used to see. You
Yeah.
know, I'm sure you also must have
We
experienced
have
that,
this bad
PR,
habit.
there's a little asymmetry. There's,
Yeah.
little teardrop is quite
Yes,
deep.
yes, yes.
Her lips are pretty thin compared to her chin.
Yeah.
So
So
we
I
have done,
think
I'm sure we all have done that.
that bad habit is there, and we practice it at airports and at hotels and at lobbies everywhere we go. I'm at
Yes.
least I find myself, analyzing faces. So which, I don't know, it comes with it.
Yes, yes.
So right. So now if you were to draft a rule book for aesthetics, so what would be the 10 most important rules?
So, I had just thought over it and I wrote down a few things and, कि क्या होना चाहिए, क्या नहीं होना चाहिए. So, rule book में, I think professional standards should be, determined
Hmm.
properly and very clearly, transparently.
Mhm.
So, when someone is assessing a patient, for example,
Mhm.
a rule book is very important. What all points you need to cover, what all, aspects you need to inform,
Mhm.
what all aspects you need to make sure that the patient is aware of, whether they are fully having the knowledge of what you are really going to do.
Mhm.
This is very important according to me. So it's like, starting from when the patient arrives in your setup, in your clinic, till the time he or she reaches home, there
Mhm.
should be a set of rules and regulations and protocols to be
Protocol,
followed,
SOPs and
which
protocol.
are exactly, which are right now pretty unclear. Everybody has their own individualistic protocols.
Yeah.
So if we can have a standardized protocol for
Mhm.
this, I think it will help us a lot.
Yeah, that would be, one great help to anybody who is practicing aesthetics. So I guess if this thought has come, maybe you might be the one to write a book on 10 rule books of aesthetics. Now, if you were
Probably.
allotted a post for a day where you had to, formulate grounds, and you have to, work in a university where you have to basically design a course in aesthetics. So what would it look like? Will it be 2 years, 3 years, diploma, degree, whatever? matlab, what would the course look like?
I think I always believe now that, I'm so many about what 13, 14 years in my practice. I believe there should be a very good balance between theory and practical.
Yeah.
So, theoretical knowledge in aesthetics
Hmm.
is at one point enough, but more on the practical approach or the hands on approach is
Right,
far, far more important and superior.
right.
Okay, so forming in curriculum basically will involve a major requirement of practical knowledge.
Hmm.
I mean, I have seen a lot of courses which obviously come on our internet windows saying that, 1 day course and 10-day course. I don't know how much will you really able to replicate it in your clinic.
Right.
It's practically very difficult. You
These
have
courses are
to,
just curtain raisers, I guess. They
yeah,
nothing.
it's just an introduction, probably,
Yeah.
to what
Can't
is
call them
aesthetics.
trainings.
Yes. So, talking about the curriculum part, I think if aesthetics was a separate kind of an entity, at least 1 year proper course is required, which will involve theory and practical and a lot of hands-on,
Okay.
and obviously an exam at the end.
Yes. With externals.
Yes.
Viva with externals.
Viva.
Right, right. Great. Wonderful. Now, in what ways do you think that corporate chain clinics and individual aesthetics differ in their approach to addressing aesthetic concerns? And what are the pros and cons of each?
So fortunately, Dr. Bhavna, I have experienced both. I have worked with a chain clinic for almost 7 years, and now that I'm in my own personal practice for 7 years. So I am eligible and I am a person to say this firsthand that definitely in chain clinics, what one advantage a patient or a client has is they can get access to world class machines,
Yes.
because being chain clinics, they have investors in place, so
Yeah.
they can afford all those high end machines.
Right.
Where an individual doctor, the pros is that you will have a personal connect with each of your patient, and
Hmm.
that patient is going to be a patient and not a client or a customer.
Right. Right.
Okay. So I still remember that the month ends used to be all about targets.
Yes.
कितना target हुआ है,
Right.
तुम्हारा क्यों नहीं हुआ,
Hmm.
call this person, call that person, and then probably
Yeah.
sometimes misleading and
Yeah.
mis-selling also
Selling
was a
also.
part and parcel of that process.
Right.
Wherein in a personal clinic, this definitely will never happen.
It can't
A
happen.
doctor has, yes, a doctor has a very do no harm. What we have this been
Yeah.
taught is
Yeah.
definitely the first thing what we do for our patients.
Right.
The
Right.
patient is well informed, is
Hmm.
taken care, the
Care of.
aftercare, the
Yeah.
maintenance, so
Mm-hmm.
many things which are there with your doctor, which I have not seen in the chain clinics.
Yeah. Clinics. Yeah. So yes, you've
So
rightly said.
definite, and of course the price factor also. See, वो होता है ना कि बल्क में लो तो सस्ता पड़ेगा,
Exactly.
और
Exactly.
इंडिविजुअल डॉक्टर को इतना इट्स नॉट प्रैक्टिकली पॉसिबल. सो
Possible.
आई पर्सनली फील दैट अ पेशेंट शुड अंडरस्टैंड व्हाट दे वांट. डू दे वांट क्वालिटी,
Yeah.
or they just want to go with the flow?
Right. Right. So that difference obviously is there, you know. Either you can do the calculations or you can do deliver the results, I guess.
Yeah, I mean, I feel that every doctor, the first thing is treating the patient.
Eating the
The
patient.
money is important. I never say that money is not important, because obviously we are also the bread earners of our family.
Yes. Yes.
So earning is important, but it cannot take a first hand over patient care.
Exactly. Exactly. Which unfortunately in chain clinics, I think is lacking maybe sometimes.
Yes.
Right. Very rightly put. So now, in your extensive practice within aesthetics, what are the most prevalent myths surrounding aging and anti-aging that you have encountered, and how do these misconceptions impact individual perceptions and choices regarding the skincare routines and treatments?
So I think one of the most common myth, which I'm sure you all have also experienced, is I don't use sunscreen at home.
Yeah. Right.
I use only when I go out of the house. So that is definitely a total no-no. You have to use your sunscreen every day, indoors, outdoors.
Yeah.
That is one very most common thing which I encounter with. And probably one more is, I'm not that old to start anti-aging treatments.
Yes, yes. That is, that is something it's very difficult to convey also that, when you say that, the earlier the better, people might, misunderstand, thinking that, okay, they're trying to sell, but it's not like that, you know.
Exactly. It's very difficult for any person to accept that they have already started aging process when they are actually in their prime of age. So, you obviously know that the aging process starts in the late 20s, early 30s. And that is the age where, obviously nowadays, so people are getting married at that age.
Yeah.
And, convincing them that aging process has started
Hmm.
is very difficult and very unbelievable concept for them.
Yes. Right. Okay.
Uh, and And I just have one more, one more. It's a
Yeah, yeah,
very
sure.
common thing, I'm sure, again, for lip fillers. A
Okay.
lot of people feel that only young people undergo lip fillers,
Oh,
wherein
yeah.
I have to keep on convincing that aging lips are far more
You,
prime candidates for
yeah,
lip fillers
lip fillers. Yes.
rather than younger people.
Yeah. Yeah. So how do what do we do to, clear all these myths, and why do they exist in the very first place? I don't know. Where are they coming from?
I think it's our culture where, we have never given importance to aesthetics and beauty. See, today, when someone goes for an interview, Dr. Bhavna, looks are equally important as is talent.
Exactly.
You know, so your presentation, your presentable features, the way you're dressing, the way your skin is, the way your hair is, everything matters,
Everything.
and you have to have a talent.
Exactly.
You know,
Yeah.
so previously, that was not the case. It was all about talent and probably some other factors, but now it is definitely important.
Important.
So, giving knowledge to patients, keeping on, social media definitely is helping
Is
by
helping.
spreading the knowledge nowadays. But then there are again pros and cons with social media you're aware of.
They misguide. Social media sometimes I feel misguides also.
Definitely, definitely. I mean, we will not go into that topic. It will
Yeah,
take
we
another
will
1 hour for us.
not. Right. Great. So now, initially we were like, skin doctors, like they were like Betnovate doctors. And because everything, whatever skin concern, skin problem, Betnovate was, everybody used to have Betnovate. But now is the time where you are sometimes, have to prescribe 4% HA and 10% niacinamide and all that. Now, prescribing skincare has become a little bit more convoluted as compared to, earlier times. So, what is your advice to beginner practitioners to cope up with this? Because it's really very difficult that how to exactly refer the right percentage and right product to a person whom you are seeing for the first time.
So, first and foremost, as I was just mentioning earlier, Dr. Bhavna, anyone and everyone who wants to get into aesthetics, first get the knowledge.
Yes.
First, study.
Hmm.
You cannot one fine day decide that, okay, I'm going to start aesthetics. मैं peel लगा दूंगा या लगा दूंगी. ऐसा नहीं होता है.
नहीं होता
You
है.
have to study. You have to understand the topic.
Right.
It's as good as then doing that 1 day course and then just sit in your clinic and start something.
Right.
Uh, I am obviously not a dermat, so I don't practice the steroid and all those things. Anyways, my
Yeah.
practice is solely into aesthetics. But for the beginners who have just passed their MBBS,
Mm-hmm.
you know, so don't think aesthetics is an easy way out or money making machine.
I feel it's the
That is
most
what.
difficult.
So that is the first mistake, a rookie mistake, what I call,
Right.
should be avoided.
Right.
Educate yourself, study. I know that there are no formal courses, but whatever way it is,
Mm-hmm.
get yourself first accustomed to the whole arena. It's a very vast thing. It's not just doing tang tang tang, यहाँ पे botox दे दिया हो गया. No, that is not how it works.
Yes. Very
Because
true.
if you're going to get into such practice,
Hmm.
not only you're going to have your own losses, but you're going to harm the overall aesthetic practice of other doctors,
Right.
because you're going to lose trust of your patients.
Exactly. And one bad
So
patient means, we know the
exactly
consequences.
one bad experience
Yeah.
and the entire that circle, ek hota hai na, herd, that
Yeah. The
one
entire
circle
fraternity
is
is put
all
in question.
perfect. So
Right.
anyone who is planning to come to aesthetics, don't think for money making
Yeah.
easy way.
Easy
That
way.
is not how aesthetics works. The most important thing which doctors lack, I feel, now I may be wrong, is people skills. Talking with
Right.
people, convincing
People.
people, consulting them, convincing them. There are so many aspects to that.
Right. And on an average, I
As
feel an
doctors,
aesthetic consultation needs at least 1.5 hours minimum.
exactly, and you should have the patience to exactly do the same.
Hmm. Right.
There's one more aspect which we doctors lack is financial planning.
Definitely. I'm in that, I'm a very bad financial planner.
I mean, I have seen some new doctors buying machines pe machines,
Yes, yes,
and then where is your ROI? What are you thinking about it? How are you going to see yourself 2 years hence, 5 years hence, 10 years hence?
yes.
You know,
I think aesthetic
there is
coaches
no
need to
nourishment.
accommodate these two also, because then there's so every other day you are coming across a new technology and it's very intimidating. Moreover, you want to give the best results. So,
Definitely.
investing into skills, into machinery, into equipments. I mean, it's so much of this. I think that this should be a chapter in the curriculum also.
Yeah, the
Financial
curriculum
planning.
chapter should have this: administration, people skills, and financial planning.
Yes. Right. So, now something interesting. If skincare was a fairy tale, who would be the hero, the villain, and the magical potion that saves the day? So, and would it end? Would it have a happy ending, or would it just a twist of fate would decide?
I think I always feel that unsupervised use of steroids is the villain.
Okay, perfect. 10 on 10.
Anywhere and everywhere, बस बेटनोवेट जैसे आपने बोला बेटनोवेट
Yes.
डॉक्टर बेटनोवेट दे दो, that is the villain.
Yeah.
uh, I would say HA, hyaluronic and sunscreen are the heroes,
Yeah. 10 on 10. Even I
because
was thinking the same.
in recent times what I've seen is even small percentage of use has made the skincare really better than what it was before.
Yes. Yes.
And what was the third thing?
What would be the ending? Is it a happily ever after ending, or is it a just leave it to the twist of fate?
No, I think if you go to the right person, right time, right place, it's always a happy ending.
Yes. Right. So with HA, I want to add, like adding just an HA into your routine, skincare routine, it can help you with, mild fine lines, even slight little bit
Yeah.
of pigmentation. That is why, it is one of the heroes in today's time.
Yes.
What is your take
Yes.
on collagen and collagen supplements?
So honestly, again, it may be controversial, but I don't believe in oral collagen supplements.
Okay.
I always call them as glorified multivitamins when you're taking it by mouth.
Right.
You will definitely notice a little bit of change in your skin, hair, and nails, but the cost which you're getting it at is not worth it.
Right.
So my personal take is I don't go for oral collagen, but I do have very good experience with oral glutathiones.
Yeah, same here. Oral glutathione works
So
very well.
yes, so I've termed this concept. I think it will be helpful for all of you all. I call it as oral anti-aging drug.
Yeah. Maybe we could, sell it like that only.
Yeah,
Instead
because
of,
see, skin lightening is something which I personally find very derogatory. That
I,
मुझे fair होना है. I don't like that. But if the antioxidant property is going to help you from inward to outward, that
yeah,
is definitely worth it.
definitely. Yes. Very rightly said. Okay, now they say knowledge is power. But can it also be the key to unlocking our skin's full potentials? How do you empower your clients with the wisdom to navigate the labyrinth of skincare beyond lotions and potions? Because we have a
So
lot of individuals, they are just coming and
true,
they're asking, tell us just one cream that can help us with all this.
very true, very true.
How do you
So
do?
as yeah. So you remember you just said some time back that every patient you have to give an hour.
Yeah.
So, in aesthetics, we see hardly 5-7 patients per day. We don't see more than that. That is exactly the reason where our entire counseling is all about educating the patient.
Yes.
No,
Yeah.
having a frank conversation and bridging the gap between what they want and what they can achieve.
Right.
Lot of times patient come with a very I don't know what to call, what magnanimous expectations. They show me some
Mhm.
pictures that, can I look like this? And
Yes.
then I have to start from the basics, like how the aging process starts,
Yes.
how your genetics, your lifestyle can affect it. And,
Right.
it goes from there, from basic, and then start telling them, okay, if you don't have the budget, we'll start with this basic thing. And
Right.
then we will slowly get into the other advanced stuff.
Okay. Right.
That is, I think patient education is the most important, because as you rightly said, social media sometimes misguides
Right,
very badly.
right. Okay, so what is one favorite treatment of yours that you yourself do on your, on your skin to keep, your skin and face glowing?
So let me tell you all a very interesting thing. In my clinic in beauty aesthetics, no treatment is introduced to my patient unless and until I am, taking it.
Oh, wow.
Whether it is an oral glutathione, whether it is a medifacial ingredient, or whether it is some kind of laser,
Okay.
or recently we've acquired Aqualix and all these kind
Mhm.
of treatments thanks
Right.
to our group. So the reason is very simple, that I need to first understand what is it going to be, how am I going to feel,
Exactly.
you know, and that is where I can relate to my patient. That when I for example I give some mesolipo injection, I can tell them that now you're going to feel the pain,
Yeah,
intense
you
pain for
have to
five
tell them the
minutes.
journey, this is what's going to happen to you day one, day two, day three.
Exactly, that is how I do in my clinic,
Wow.
because I need to understand what is it thoroughly
Hmm.
before I give it to my patient.
Right. And, telling on this note, when the day got Botox done on myself, was it changed the way I was talking about, Botox and consultations, and even I was surprised at
Yes.
myself, the way I was talking, the confidence with which I was talking, and, it was completely different, So that's where I realized that if you experience it yourself, it changes the way you talk about it.
So, on this exact note, I have seen many doctors who are yet not doing Botox on themselves, but are trying to sell their Botox, and their conversion is very low. Okay.
Yeah, yeah.
This is the exact reason, that if you don't know what is happening, what you're
Hmm,
going to experience, what you're going to feel, what is the outcome, how will you convince your patient?
exactly. Very true. So this is something important.
So,
To at least experience, whether you need it or
very
not,
important.
to have an experience of
Yes,
it is a good idea because
exactly.
you are dealing with healthy people. They can fine.
Definitely.
So it was lovely having such lovely insights and great insights from you. So
Thank
thank you
you.
so much for sharing and coming. Have a great day.
Thank you so much.
Thank you. Thanks a lot. Take care.
Bye bye.
Bye.